Hey guys, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we are going to be talking about the drug class Carbapenums. Let's break it down. To get started, let's talk about what is this class of drugs. So, carbapenems are antibiotics, and they are also known as beta-lactams. Beta-lactams basically just has to do with the shape of the molecule. Carbapenems are not the only types of beta-lactams. The other two I previously discussed are penicillins and cephalosporins. Please note that these are other drug classes, so penicillins are not carbapenems, cephalosporins are not carbapenems. There are just other two beta-lactams, and I just want you guys to think about grouping them together. So all three of these are beta-lactams. Next up, two examples that fall under the class of carbapenems are ertapenem and deripenem. Now, you can probably already see what these have in common. So we're actually going to look at the suffix of penem. So the drugs that fall under the classification of carbapenem are going to have the ending of penem. So when you see the suffix, you're going to know that any drug that has this ending is going to fall under this classification. What makes this class different from other classes of antibiotics? This is actually an expanded spectrum of beta-lactam. So it's going to treat even more and broader scope of things in comparison to these beta-lactams. Another difference is carbapenems are administered via IV. So most commonly, you're going to see this drug administered in an acute care setting, hospital setting, etc. because it's administered through an IV. Depending on the patient and depending on the drug, we might have some effects that we are not looking for. So remember, ADE stands for Adverse Drug Effect. Now, some of these effects that we might see include chest pain, an increased risk of seizure, or CNS abnormalities. CNS standing for Central Nervous System Abnormalities. So we will not see this with every single patient, but these are some effects that we might see. I hope you guys learned a little bit about the drug class of carbapenems. Come back to my page to learn more.